Coming up next on Arizona Horizon, President Trump has now endorsed 2 Arizona Republicans running for governor, what it means for next year's election. Also tonight, new research is changing what we know about valley fever. And a major addition to the Phoenix Bioscience Corps looks to turn scientific breakthroughs into patient treatments. Those stories and more next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your public television station.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. A couple of court cases of note. A federal judge today limited the Trump administration's ability to block federal funds from public schools that have certain DEI initiatives. The judge said that the policy threatened free speech, adding that it didn't help that the administration couldn't adequately define what DEI is. The judge also ruled that the Education Department's order overstepped the executive branch's legal authority over local schools. And another federal judge today blocked at least parts of the president's executive order expanding proof of citizenship requirements for federal voter registration. The judge wrote that the Constitution entrusts Congress and the states, not the president, with the authority to regulate federal elections. The block will remain in place while a lawsuit on the matter plays out. Gas prices are up this week, but not by much. That's according to AAA, which reports that the average price for a gallon of regular is $3.37. That's up a penny a gallon from last week. It's down from the $4.10 a gallon average last year. That said, Arizona gas prices are 8th highest in the country and 20 cents a gallon above the national average. Home sales were down big time in March. Sales of previously owned homes in the U.S. dropped 6% from the previous month. It's the weakest month of March for home sales since 2009. All this as the median price of an existing home hit record highs. And political note, Arizona Secretary of State Adrian Fontes today announced that he is running for re-election. Fontes, a Democrat, issued a statement saying that, quote, our institutions are under a grave threat and that he intends to, quote, remain at my post, standing in the breach, fighting for Arizonans. Fontes is the only Democrat to announce for the seat. Republican Alexander Culloden announced his candidacy last month. President Trump last week endorsed Congressman Andy Biggs for governor. This a few months after endorsing another Republican, Karen Taylor Robson, for governor. What does it mean for next year's GOP primary and general election? We ask political consultant Chuck Coughlin, president of High Ground. Good to see you. Thanks for joining us.
Thanks, Ted. Thanks for being here.
Okay, they're both endorsed. How does that work?
It's Trump 101, right? I mean, he's got a history of doing this. He did this up in the congressional district race in CD8 last time with Abe Hamina and Blake Masters. But you know, a lot of people anticipated this because he endorsed Karen at a Turning Point rally in December of this past year and got a little pushback from some of the more conservative parts of the party. And then Congressman Biggs announced, Congressman Biggs, the head of the Freedom Caucus, and many of us were doing the math on the resolution, the budget resolution, which we all remember. There was like 12 or 15 Freedom Caucus Republicans who were no. They were a no on that, and many of us were thinking, okay, that's the end of the budget resolution, and then boom, the next day, they voted almost en masse for the budget resolution. Many of us thought maybe there was a few trade-offs there that may have taken place, and I believe that at that point, Mr. Biggs secured the commitment of the president to endorse him as well.
And yet, in capital letters, the president texted out, give my complete and total endorsement to both. Yeah. I mean, what does that mean? And what does it mean politically in the political class? What does it mean to the average person in Arizona who may think, I like Trump, I like MAGA, I want to follow him? Where do they follow him?
Well, I mean, it's a pure blood MAGA endorsement, right? I mean, Biggs was the chairman of the Freedom Caucus. He has never passed a bill in Congress in his entire time there. And he is pretty much a deconstructionist. You know, somebody who really doesn't believe in the role of government. I would call him mostly an ideological libertarian. And a lot of that appeals to the Doge, you know, eliminate waste crowd, which is that, you know, remember, it's only 20% of Republicans that vote in a Republican primary. And these are your most loyal MAGA folks. And so it's And you have Turning Point. You have Turning Point here in Arizona,
Right.
which is an advocacy organization for very strong MAGA interest, and they seem to be supporting Mr. Biggs.
So what does it mean for Karen Taylor Robson?
Well, it's not great news. She's going to have to work hard. It's her business record that she was running on. She's a successful businesswoman. She's been an entitlement lawyer for DMB, which is a very developed all kinds of properties around the state. Her brother was the former Maricopa County supervisor, chairman of the board. Her father was a Senate president way back in the day. So the family has a long line of public service, and she has a record of business accomplishment. Her argument's going to be, if you want somebody to get something done, I'm your gal. And I think that's going to be a very hard campaign to run, but she is blessed with a great deal of resources. Her husband is Ed Robson, Robson Communities, and Ed loves his wife. And so Ed's going to do whatever he can to support her.
But she can say, I mean, she can take the offensive against Congressman Biggs to a certain degree, but the MAGA crowd can take a lot of offense against Karen Taylor. I mean, already the head of the Arizona Freedom Caucus, KTAR, is the swamp. I mean, that's what she has to go against in the primary.
But she's going to have this amazing fundraising advantage. I think she had, in her last report, had over 4,000 individual contributors. She has $1 million in her PAC. In the last quarter, she raised over $850,000 in just for her campaign. So it becomes a turnout campaign. What can you take that Republican turnout, and can you turn that into 25, 26%? And make it a referendum, and decided not to run again.
Yes.
He endorsed Mr. Biggs. Christine ran against him as a carpetbagger. She didn't even live in the district. She came 9 votes away from beating him in that cycle. That's the only competitive race he's ever had.
Yeah, I think we tend to forget this is a statewide race.
This is a
and
statewide
Congressman
race.
Biggs is very well known in the Valley and extremely well known in the East Valley. Other parts of the state, maybe not so much.
Not so much. I mean, that his district, District 5, very, very deeply Republican district. It will never be represented by a Democrat. We were talking today, it's been white, mostly Mormon men that have represented that district for many, many years.
That being said, you mentioned Democrats. What do the Democrats think about all this, and how does Governor Hobbs, what does she want to see?
I think she's ringing the dinner bell on this one. I think she's pretty happy that this has turned into what she had hoped would be a significant competitive fight on the Republican side, similar to what we saw last time. We saw in the gubernatorial cycle last time, Karen and Matt. Matt didn't drop out till very late.
Yes.
His name was still on the ballot. There's people that have said if Matt had dropped out earlier, his name's not on the ballot, Karen probably wins that race. And so it was a very competitive race. And I'm pretty confident it's going to be a competitive race. And of course, Mrs. Hobbs will very much enjoy watching the Republicans beat the tar out of one another.
Who would she rather face?
My instinct would be rather face Mr. Biggs because of the narrownesses of his constituency, that he's never run statewide before, that he doesn't have a perceived broad base of support. You know, you need in Arizona, in order to win a statewide election, you need a majority of Republicans, but you also need a plurality of unaffiliated voters. And I think Mrs. Hobbs would feel advantaged in talking to those types of voters.
Last question. Could someone at the last second pop up in the Republican primary to just gum up the works and make us rethink the numbers there? Could someone jump into the general election as a third candidate and gum up the works there?
Well, I'm going to do one better. I'm not clear that the Democratic primary is going to be an unfettered affair
Interesting.
either.
Interesting.
I believe, there's a lot of questions about Governor Hobbs and her confidence within the party and her ability to win a statewide election. And so there's questions there. I know Mr. Fontes announced his
Yes.
re-election campaign today. You have Mrs. Mays, who's been the forefront of the state's opposition to the Trump administration. You have other people in the business community and Democrats that aren't necessarily pleased with her as well. And then, like you said, I think it's going to be really hard. I've always thought that an independent candidate would have a shot. It's really, really hard because you have a significant amount of partisans. You know, you have 35% of Democrats and 35, that shows up in an election, and that's your dedicated base. And so, you know, you're not left with a lot of the electorate that if you're running as an independent to play with. And the big problem there is you disappear until the general election happens.
Right, but you could be a spanner in the works.
You could. I mean, I don't think anything's off the table right now.
Yeah.
I would think I'd keep my eyes on the ball, see what this is going to look like. We're months and months away from calling this in any serious way. It's going to be a very entertaining year. You'll have lots more guests to talk about.
We're
this.
trying to keep our eye on the ball all the time, Rich. Good to see you again. Good stuff. Thanks for joining
the
us.
Opportunity.
Friday night at 9 on Arizona PBS.
Hi, I'm Catherine Anaya, host of Horizonte, the groundbreaking program that has served as a platform for Arizona's Latino community for more than 2 decades.
Latinos care about issues across the board, just like everyone else.
There's a lot of diversity in thought and opinion. We just need to make sure parents understand the value in having multilingual students.
We like to hear our voices heard. Stream episodes online at azpbs.org, YouTube, or on the PBS app.
Researchers at ASU's Health Observatory are using environmental data to help doctors better diagnose and prevent the spread of valley fever. To learn more, we welcome Dr. David Engelthaler. He's Executive Director of the Health Observatory, part of ASU Health. Good to see you again.
Good to see you too, Ted.
Yeah, before we get too far here, ASU Health Observatory, what is that?
Yeah, this is part of the new enterprise called ASU Health, which includes a new medical school, a new public health school, bringing together some of the other great schools around health, but building a new asset for the state of Arizona. The Health Observatory is really charged with, let's bring together health data and transform that into health knowledge. So, and then use that to share with public health leaders, health officials, but also the general public so we can make better decisions in our own lives.
And we're going to talk about how that affects valley fever and the investigation into valley fever in a second here. But for people that are new here, what is valley fever? Because a lot of us know what it is.
Yeah, well, valley fever is definitely Arizona's disease. This is a microscopic fungus that loves to live in hot, dry soils. And then if it gets up in the air, you can breathe it in, you can get pneumonia. It could actually cause some more serious illness as well in a few individuals. But what it does is it keeps people out of school, it keeps people out of work. It has a tremendous effect on us.
Does exposure always mean illness?
Definitely not. So actually the majority of individuals who get exposed, and the CDC thinks it's north of 300,000 people every year in the Southwest get exposed. The majority of them don't develop symptoms, or if they do, they're mild enough that they don't go see a doctor.
And again, flu-like fatigue, rashes, these sorts of things.
Correct. A lot of those things that you'll stay home from work, sometimes for a week or more.
Well, I remember a long time ago when I was first hearing about valley fever, the word was you get it, you're down, and you're out for a long time. Is that still the case?
It definitely can be. So people who get it, they can get walking pneumonia, and then they just want to sleep. They want to stay in bed. And that could last for weeks and sometimes even a month or more.
Is there a diagnostic test as we speak that says yay or nay, you got it, you don't?
So this is great. Arizona's institutions like ASU, like TGen, have been working in building diagnostics. So there are diagnostic tests out there, but what we're trying to do is make them faster and cheaper and smarter. So both genomic-based as well as blood-based tests.
And correct me if I'm wrong, but isn't it often misdiagnosed as pneumonia?
Yeah, in fact, most pneumonia cases are not even tested for valley fever, when a very large percentage, maybe 30 or 40% of those actually are valley fever and they're not even tested.
Can you have half and half? Can you have pneumonia and then find out you got a little bit of valley fever? Not a lot, but you got a little bit going there.
Well, anytime you have some type of a lung infection, it sets you up for additional infections as well. We see that with flu and bacterial infections. It's possible.
What kind of data now is being used to learn more about valley fever?
Yeah, one of the things that I'm excited about with the Health Observatory and with our friends at TGen2 is that we're able to collect much more precise information, advanced technologies, genomics. We can use AI for interpreting this and better understand the fungus, where it lives, how it gets up into the air, and really then who's going to be at risk for exposure. So we are bringing a lot of new technology to this.
Now, and correct me if I'm wrong, gang, but looking through all of this, the idea is always after a dust storm, boy, watch out, because everything's all mixed up in the air.
Yeah.
But you're saying not necessarily. So what's that about?
You know, I grew up in the Southwest, and we heard this, stay out of those dust storms. Turns out that it's actually mythology. When we look into air filters, we see no difference in the days before these big haboob dust storms,
Yes.
the days of and the days after. No statistical difference whatsoever. The reason being is that this fungus lives in the soil, typically where rodents are, rodent burrows, and that soil has to be disturbed. So down below the surface, get up into the air. So like construction or other things that will dig up that dirt. And then the surrounding region is most exposed. It's not these big giant dust storms that are moving across.
And we think of fungus, we think of something, moisture there somewhere, but really not for this, right?
Yeah, this particular fungus loves the hot, dry soils.
Wow.
Probably because it can then outcompete other things that can't grow in that.
And again, in looking at this, you mentioned, kind of referred to this, dead rodents, even dead rodents that are decaying like under the soil, that fungus is still there and poof, it comes up.
Yeah, we used to think of this as just a soil fungus, but really it's an animal fungus. Animals, mammals can get it. If an animal dies underground, that body decays and then the fungus will grow greatly right there in that location. So we see a lot of fungus around animal burrows underground in the Sonoran Desert.
So how far along is the research now into this, especially in terms of better diagnosing it?
Yes, we have, so everything from the whole system, understanding where it grows, how it gets in the air, who's going to be exposed, and then how do we better test those people. We're moving on all fronts. There are some diagnostics that are available now. We've developed some of the genetic-based diagnostics like we had for COVID, but we're also developing better blood tests at ASU.
And last question, I would imagine communication on this, learn lessons from the pandemic, huh?
Yeah, the Health Observatory, maybe the most important thing is that I think we were all searching for a trusted source of health information. That wasn't maybe the government and maybe it wasn't the big vaccine companies. We want to build that for Arizona where we work with all of our health partners, but then get real useful information and knowledge out.
All right, Dr. David Engelthaler, again, ASU Health Observatory. It's good to see you.
Thanks, Ted.
Tonight on the NewsHour, a deadly Russian attack on Kyiv threatens to further derail the peace process. That's coming up at 6 on Arizona PBS.
Honor Health Research Institute recently opened its first major lab at the Phoenix Bioscience Core, the goal to fast-track research into real-world treatments. Dr. Sunil Sharma is the director of the Center for Translational Science at Honor Health Research Institute, also associated with ASU, too?
Correct.
Correct. All right. Good to have you here. Welcome to Arizona Horizon.
Thank you very much.
A translational science lab down there at that hub. What are we talking about?
Basically, the idea here is to bring sort of what we call bench to bedside research, meaning take the clinical, the strength in the clinical system that Honor Health has and all our big hospitals have, and actually use that information to develop new treatments, diagnostics, etc., in the laboratory, and then sort of cycle them back to the clinic. So what we mean by translational research is real bench to bedside exchange. You could imagine, for instance, learning from the clinical physicians and patient advocates who are passionate about a particular disease. I'll pick one out of the hat, for instance, brain tumors. And then today, for instance, we had a big meeting between all of the neurosurgeons and neuro-oncologists at Honor Health, and what kind of technologies can we bring to fast forward the early diagnosis of brain tumors or develop new treatments for brain tumors. And so the laboratory works almost hand in hand with the clinical people to advance the science that is being produced all around the valley, or take advantage of the science produced really all around the world and translate that quickly into for the benefit of patients.
Is it disease specific, or is it more of a broad view?
Great question. The way medicine is evolving is sort of on two kind of related spheres. One is we are obviously disease specific from the point of view of developing excellence or specialization around special diseases. As far as when you go and see a rheumatologist or an endocrinologist, you're actually asking for specialization. On the other hand, a lot of the things that sort of, lot of the pathways, a lot of proteins, a lot of genes that sort of drive these diseases can be shared across the spectrum. And so that's what I call the crossroads, and the lab and the whole center is actually trying to work at these crossroads, meaning bringing the knowledge of science across different pathways and apply them to specific diseases.
Now, are you using other people's research, or is this a way to really focus on your own research going from bench to patient?
Yeah, that's a great question. We actually leverage a large amount of basic science that is developed at all around the world at ASU and other places, and then bring that a step closer towards the clinic. So I'll give you an example of this without making it super complicated. For instance, one of the stories you might have heard, the FDA recently produced an edict where they're trying to phase out animal testing. You might have heard of that story. What we have developed are models for cancer that are derived from the patient tissue, for instance, and we can use those models to model disease and develop treatments without necessarily using, animal models. So that's just one way of thinking about how we can take basic science research and translate it into the clinic.
Now, this a significant footprint at the Center for Translational Science. This is the Phoenix Bioscience Core. Talk to us about what's going on down there, where it's located, and how this fits in, because it sounds like it fits in pretty big.
Yes, it does. It's actually the whole excitement around that whole downtown bioscience, I call it the bioscience assets that Arizona is developing. We are also part of the School of Medical Engineering that is now building the new ASU's medical school, so we're also affiliated very closely with the ASU's new ASU Health that Dr. Engelthaler was talking about before, and helping to develop the research portfolio for the ASU's new medical school. As you probably know, ASU's new medical school, the clinical affiliation is with Honor Health. And so the students that are going to be admitted to the ASU's new medical school will have all the clinical rotations in Honor Health, and we are providing this bridge between research and clinical care, not only for the physicians at Honor Health or other places, but also to medical students in the future.
Back to the research real quickly. Will this result in spin-off projects, spin-off industries, companies, these sorts of things?
Yeah, that's a big hope, because before I joined and started to build the Center for Translational Science, I was part of TGen and spun out many different companies from this similar kind of effort, and we're going to only intensify that. Of course, this is very important for that whole bioscience core to have a very strong commercial spin-out and really build the ecosystem for innovation. That's what I would call it. And it's been it's been built for a long time, and really with the new medical school, the Honor Health Affiliation Agreement, the Center for Translational Science, and the Health Observatory and other components of ASU Health, it's really a fantastic time to be there, and really to the benefit of all the people in Arizona.
Yeah, real quickly again now, where are we? What's the timeline going on here?
The timeline is sort of a long-term timeline in the sense that we have already many different projects getting started, and the idea is let's show some real progress in the next few years, both in the area of innovation, changing clinical care, and medical education.
All right, Dr. Sunil Sharma. Again, Honor Health, the Center for Translational Science, and ASU, and the Bioscience Hub. A lot going on down there.
Absolutely.
Yeah, thanks for taking time to join us.
Thank you, Ted.
Thank you.
Appreciate it.
And that is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening. Gotcha.